evening, ladies and gentlemen. Welcome to another exciting episode of Paul Brown Show. This evening, I have two exciting guests. I have Miss Janice Shirley to my right, and I have Miss Bernadette Moss. How y'all ladies doing today?
We're good.
Great. Thank you for having us.
We're talking about a very deep topic. We're talking about HIV. First of all, tell us a little bit about yourself, Miss Shirley.
My name is Janice Shirley. I'm an HIV advocate. I'm also a certified peer support specialist, along with being an advanced level facilitator. I'm also the liaison for the BTAN chapter here in Charlotte, which stands for Black Treatment Advocacy Network. We're a chapter that is connected to the BAI, which is the Black AIDS Institute out in Los Angeles.
And yourself?
My name is Bernadette Moss. I'm the Prevention Program Manager for Carolina's Care Partnership. And so basically what my job is to go out into the community, teach about HIV prevention, and to also do testing.
First of all, we're going to talk about, tell us a little bit about HIV. Tell us about HIV. Why did y'all talk about HIV?
Well, I moved into this field just because I have a passion for marginalized communities. I get paid on a daily basis to talk about sex. What better job is out there than that? So I appreciate that.
And yourself?
One reason why I'm so passionate about HIV because 13 years ago I contracted HIV. So not knowing about HIV, not having the right people in my corner to even school me on HIV, to learn me about HIV, I set out on my own to start learning about what is it about HIV, what I needed to do, how I needed to take care of myself, what type of medicines I needed. And I've been on a mission ever since.
Okay, Ms. Shirley. Okay, you said you contracted HIV. Now, if this is not personal, how did you contract it?
I contracted from my daughter's father, which when he was questioned about it, when I questioned him about it, it was like, no, he didn't have it. But come to find out, toward the end, he did have it. He still he has it. So he's still living with it.
Okay, how did you take that? How did you find out exactly that you had it? Did you go to get tested, or how did you find out that you had HIV?
I know I was. It started out. I was going to go to Johnson and Wales. I wanted to go to the culinary school. I wanted to be one of the great cooks. I don't know whether or not people remember way back in the day when we had a white lady named Miss Betty Feeser. She used to be on television on Channel 3. And so she used to do a lot of that cooking, and I used to sit there and watch her show, me and my grandmother. And so I learned a lot of cooking and stuff from my grandmother. And so I went to sign up for the school, but when you get the orientation package, it has in the package that you have to go have a physical. And in the physical, I went to have a physical at the health department. And so they asked me the question, do you want to take the HIV test? I'm like, yeah, go ahead. I just did it like that. And I think a couple of weeks later or a week or two later, I received a certified letter in the mail that I needed to go to the post office to pick up. And I picked up the letter from the post office. I didn't open it until I got back home. When I got back home, it was having me come down to the health. I needed to call the health department, and they asked me to come down. They set a date for me to come down. And when I got back to the health department, they told me I had HIV.
Why is prevention such a big thing, Ms. Moss, being that you're in that field?
Wow, because we want to prevent the spread of HIV. Currently, HIV statistics is so heavy in our communities, in African American communities, where we know that 1 in 2 Black men who have sex with other men will get HIV in their lifetime. That is a startling statistic. You have 2 Black men who have sex with other men. One of them is going to have HIV. That, to me, is plenty of reason for me to be in prevention, to go out and educate people to, first of all, help them understand how the virus is transmitted. That's one of my passions, and also to eliminate the stigma from it so that people who are HIV positive are not treated in negative ways, who are not, put to the side in society, that we're integrated into society. Because once we have that education surrounding how the virus is transmitted, we can interact with people in normal, common ways and not make them feel negative. So that's another reason why I'm in HIV prevention. And it's just like a passion. I want to be on the front lines preventing the epidemic. There's some people whose passion is once the person has the virus, working with them and serving them, I want to be on the front lines to prevent that.
Okay, y'all provided me with some statistic as far as Mecklenburg County Brief the audience a little bit on those statistics that they're probably not aware of.
Well, if your audience members are of my age, they remember the onset of the HIV crisis when it was gay white men. That's where the epidemic, kind of the media attention was focused on the gay white man. Well, there were dollars and advocacy and everything focused on that. Well, that demographic has shifted now, and HIV primarily affects Black and brown people and poor people. And so here in Mecklenburg County in 2016, 71% of new HIV cases were among Black people. Okay. Of that total, 82% of them were men. So right now, Black men who have sex with men, just like that statistic I gave you, 1 and 2, these are the numbers here in Mecklenburg County. It shows the same data across the country that Black men who have sex with other men are the highest risk category out there. And there are preventative measures that a lot of people may not know about. They may have seen a commercial for a medication called PrEP. It is kind of like HIV. It's kind of like birth control for HIV. So you take a pill every day to prevent HIV infection. So let's think back to when I said that minority people and poor people are the ones who are most at risk for HIV. And then you think about something like PrEP, a medication that, although we don't have a cure, could get us to no new infections. Why is this medication so expensive and oftentimes out of reach for people who need it? And for that reason, I always tell people that HIV is very much a social justice issue. When you take the morality out of it, when you take the sex out of it, when you think about why people get HIV today in our communities, it's oftentimes lack of education, poverty, all the circumstances that come together to make this a challenge in our communities. And I challenge the church even as well, because the Black church has always been on the front lines fighting for us. Where are they now that we have this crisis in our communities? We make a moral judgment when, if I can reference Jesus, who served the lepers, he served the people in society that nobody else, the people that people threw away. Okay. Yeah. And so our churches now, we're not following Jesus's example. And I challenge our churches to get on the front lines and to help us fight. Take your morality out of it and fight with us so that we can end this epidemic in our communities. Because who else is going to fight for us if we don't fight for ourselves?
When should we get tested for the HIV?
That's a good question. The CDC says get tested every 3 to 6 months. And I always get on my soapbox on this topic because we have folks who are in monogamous relationships. And I give monogamy air quotes because I know what I'm doing, but do I know what my partner's doing? And a lot of times we put our health in our partner's hands when that's my responsibility. I have 3 little people who call me mom, and so I want to make sure that I am on top of everything that I can be on top of, making sure that I'm around for a long time for them. Yeah. And so while we have folks who say that, well, if my partner's good, that means I'm good, or, I don't need to get tested because I'm in a monogamous relationship. I say, even if you are, get tested at least every year. When you go for your annual physical, ask them to give you a sexual health workup. Okay? But if you're not in a monogamous relationship, every 3 to 6 months, make sure you're getting tested.
Okay, I know. So doesn't trust have a lot to do with that? Because I think a lot of times when we get in these relationships, we feel like if our partner says that they're not doing anything, that we take that word, and then if they say, well, if you say I'm going to take a test, they think that, well, you don't trust me.
Mm-hmm. And even if I can piggyback on that, sometimes people are reluctant to take the test because they feel like if I take an HIV test, that means I'm gay. Let's take that myth out of there to begin with. But, trust is a tricky thing. I'm on the front lines of this, so I see this often where there are people in relationships who are trusting their partner and that partner is not faithful. And I'm not here to cast doubt on people's partners. I'm just saying that be your own health advocate. You know your partner. I don't know people's situations. I don't know their partners, but get tested anyway. Like, what harm does it do to just get regular testing done? And the sooner you can start, the better. Like teaching our kids, do this on a regular basis. Train them up so that they know you should get tested this often.
Correct.
And, we don't do that. We're in an abstinence-based education state. And that's one of the reasons why North Carolina ranks number 8 out of all 50 states for new HIV infection. Top 10. Our state. I'm just saying.
That's some real, Miss Shirley, when you found out that you had HIV, how did your friends and family take it?
I don't think it was, that thought was in my head as for how they would take me. I know for me, I carried it for, when I found out I was HIV positive, I think I had 3 years clean. I held that for 2 years. I can remember sitting in a meeting with some people and some discussion was going on, and I opened up with a discussion. And when I said that I was HIV positive, you can see, like, for me, my vision is like the room went out and then it came back in, and it was like some relief off of my shoulders, because it was like I was carrying it, and I was so afraid of people finding out that I was HIV positive. Because, and another thing, I have 16 years clean, so I'm a recovering addict. In 2 more months, I have 17 years clean.
Yes.
So when by me finding that out, and I trusted someone with my secret, and she felt as though it was up to her to go allow somebody to. She felt like it was up to her to go let somebody know about my secret. So, in the end, once I end up doing self-disclosure, it gets a little bit better, and it's gotten a lot more better, but there's still I always tell people there's still another level of acceptance that I need to get to. I can sit here and talk. I can sit in the office and talk. I can sit at my NA meetings and, do self-disclosure. But it's something about when I'm going into a relationship, or I see somebody I like and somebody like me, and for a minute I got to dang, I got to tell him. I think that's my biggest struggle. I think that's that level of acceptance that I haven't completely reached yet. So, it'd be sometimes like I'd be like, well, damn, listen, I need to tell you something. You know what I'm saying? Because I want to give them a choice, because I wasn't given a choice.
Correct.
So I allow myself to do that. And in the end, if they stay, they stay. If they don't, they don't. I just have to keep moving. Yeah. But like they always say, what's for me gonna be for me.
Mm-hmm.
I know we go through society and we say, well, we're afraid to go to doctors. Now, I know having an HIV test, a lot of people just don't want to have that because of the fact that they don't want to know the answer. So why is it so important that we go, and when we take a physical web, to have those tests done?
I think, like when Miss Bernadette said, as for going to get tested and finding out whether or not you're HIV positive. Some people think that when they find out, by them not finding, it's like I know, but then I don't know, and by me not knowing, then nothing's going to happen to me. Mm-hmm. It's like I can cure myself. Okay. You know what I'm saying? But I always tell people that I come in contact with, when you find out, and if you found out, just think about that piece like that's God that's opening up. God has led you to the doctor. God has led you there to get tested. Now that you found out what's going on with you, I need for you to take your medication. Because that, I feel like that's life-saving. Mm-hmm. And you have some people that just feel like it'll go away, and it's not just gonna go away. You'll go away, but it's not gonna go away.
And I always tell people knowledge is power. You can't do anything about something that you don't know about. And while people are not, 1 in 8 people have HIV and they don't know it. And while you don't know it, number one, your health is deteriorating, because we know that the sooner people get into care, the better their health outcomes are. And not only that, you could be potentially spreading the virus to your partner. And so getting tested is essential, not only yourself, but your partner. You can also, like we talked about before, oh, my partner got tested. Or I hear people all the time say, well, my partner just had a baby, or she just got tested, so she's good. Particularly men will say that they're good because their partner's good. But I'm like, no, I need you to get tested too. You have to know your own status. It's empowering to know your own status.
I think we probably have a big issue as far as our youth, because you see a lot of young individuals ladies having babies at a very early age, and they're guys, they're going from ladies to girls to girls. So, what advice would you give these young ladies that's out there, who finds a guy looks good and they're willing to have unprotected sex?
All that glitters ain't gold. Yeah. And for me, it's always a tremendous red flag if a person is unwilling to get tested. What does that say? What's the underlying message that person is giving you? Number one, that they don't care about your health, and they probably don't care about theirs either. So that's like the number one red flag. And a lot of times we as women, we want to overlook those red flags because the package looks nice. Mm-hmm. And so I challenge young women to, like I said, be your own health advocate. I don't care what that package looks like. sometimes folks will have sex with other people because they say they look clean. I need people to go beyond the physical, what things look like, and you got to dig a little bit deeper. And if your partner's unwilling to get tested or unwilling to use barriers, latex barriers, condoms, dental dams, female condoms, that's sending a very clear message. And I don't care what your feelings are for that person. My opinion is you keep it moving.
Yeah, because I know when I first got clean, I had a one young lady come up to me and she said, before y'all start having relationships or liking people, make sure he went to the health department and got tested. Mm-hmm. He said, ask him for their HIV test. You know, even when I went into treatment, the first thing that they do when we get there, they make sure we are going to the doctors, we're getting physicals. Not only when we went in, when we was, like say they graduated us from the program. So when I first went into treatment, all that was lined up for me. Go to the doctor, dentist, get my eyes checked. They made sure all of that was done. You know, while I was there, so I would know what was going on with me. So when I graduated from that program, close to like 2 years clean, and then a year later, I have HIV. I knew that I didn't have it going in. I knew that it didn't come from my drug use, from me going in. You know, so it's always good to get tested. And the little young girls that's running around here thinking it's cute, doing what they doing, all because the guy got this, that, and other. Those are the ones that I'm most concerned with. You know, having unprotected sex. You're having babies and then you're not finding out that you're HIV positive. Then your baby is born HIV positive, which could be prevented. Even if they found out that you are HIV positive. It's medicine that you can take while you're pregnant so that your baby don't come out positive. You know, so it's some stuff out here to help people. They just got to be willing to do what they need to do. Like go to the doctor, get tested. You know, even when you find out if you're positive, take your medication. Continue going to your doctor's appointment. Reach out for help. We got all kind of stuff, support groups. Miss Bernadette, I love Miss Bernadette. You need to come and see one of her HIV 101 trainings. You know what I'm saying?
Which, like, I think it's so important that your audience is aware of like what HIV is and how it works. So HIV stands for Human Immunodeficiency Virus. It's a virus that breaks down your immune system. It's only transmitted from person to person. So a mosquito bite is not going to transmit HIV. I think that when we break down the stigma and the miseducation about it, then we can have real conversations, real dialogue about HIV. It's only transmitted through unprotected sex and injection drug use. There's only 5 fluids that will transmit HIV, and that's blood, semen, vaginal fluid, breast milk, and rectal fluid. You have to come in contact with those fluids and have an opening in order to get the virus. But HIV is not the death sentence that it was back in the 80s and 90s. Due like Ms. Janice said, to the advancement of medication, people can live a normal, healthy life, even a normal, healthy sex life, due to what this new kind of campaign that's out that says that undetectable equals untransmittable. And what that basically means is that when a person takes their medication in the way that they're supposed to, sees their doctor regularly, they become undetectable, meaning there's so few copies of the virus in their body that they cannot give it to their partner. Okay? So normal, healthy sex life. And I think that's wonderful. That means that people can, you know, live their lives and not be under this stigma that's associated with HIV. And just like take somebody like Magic Johnson, he's probably considered undetectable. And some people think, okay, because he's got this money, he's got access to different medications. That's not the case. Magic Johnson, you know, the money plays into it, whereas like sometimes folks who are HIV positive also have substance use issues, mental health issues, homelessness. And if you don't have a place to sleep, do you care about your HIV medication? No, you need a place to sleep. And so Magic Johnson has survived for a long time, partly because of genetics. The money plays into it because his basic needs are met, but it just varies greatly. How HIV impacts each person is going to be different. Okay, so people look at Magic Johnson like he must be cured because he has all this money, and that's just not the case.
How much is the cost for that medication for HIV?
Well, that can be anywhere from $2,000 to $6,000 per month. Okay, and so fortunately in North Carolina, there's nobody on a waiting list for medication. But as far as I know, in places like Mississippi, there are folks who are on waiting lists who can't get their medication. And so fortunately here, folks are not waiting for their medication. Medication is essential. Like getting people to be virally suppressed, that is the primary goal. And so in my job in prevention, if I test a person positive, I also do linkage to care. So I walk that person through the process, go to them with their first doctor's appointment, hold their hand as much as they need me to get them where they need to be. And that's essential. Like and the person who tells you you're positive can be that same person who takes you to your doctor's appointment. Now you've built a bond with this person. You've created a relationship and you're helping them walk through that process. So at Carolina's Care Partnership, you're not just going to test positive and then we just say, good luck, figure it out. We're going to help you get to your doctor's appointments, provide transportation if we can. If you need housing, we have that component as well. So we can support that person comprehensively. We have mental health workers on staff too, so that, we get that component as well.
Do we have a lot of support groups for people that have already been diagnosed with HIV, but, don't want to tell anybody? Like NA, AA type groups like that.
Well, we have, I do a support group at our agency, and it's Thriving at 50. That's what it's called, Thriving at 50 Plus. And so we're starting at the beginning of the year, we will start back meeting, and we'll be meeting every other month. I just got through with a 6-month community education group that was through Gilead. I received that $2,500 Gilead grant for community education, so we did that. We did that group for 6 months. Like I said, at the beginning of the year, we will start at Regional Housing Partnership. We will start our CAM meeting back up in January. Also, I believe Radio has one, which is Rosedale, and they're located off of. They're not. Oh, I'm sorry. But anyway, there's also one called Crew, and Crew is located over there on the back part of Detox. Yeah. So they do a lot. They do a lot of groups with people with HIV, transgender, all that component right there, and linkage to care and stuff like that. So there are some groups. People just have to get out here. And one thing I be wanting to stress to social workers and case managers that are dealing with people with HIV, find out this information for them. Because that was one of the things that made me strive to want to learn more about HIV, because the people that I came in contact with didn't educate me about what I had and what I needed to do. So when you're working with an HIV patient, they need everything they can to be successful. Whether or not they use it or not, you've been okay with the information. So, when they reach out, let them know about the support groups. Find out about the support groups. They're not that hard. They can call our agency and we can. I just don't have a list of them, but those was 2 of them, Minds and Crew, behind Detox off of Billingsley Road.
Bernadette, I bet we may have a lot of people that want to know why you wanted to get in this field. What's your passion behind dealing with HIV?
Well, HIV, I just kind of stumbled in it. I know that was the universe putting me where I needed to be, but I had a degree in business, and I didn't feel happy in that degree, because it's like, okay, crunch numbers, business stuff, and then go home and like, who did I help? Who did I serve? What did I do to impact somebody's life? And so I had kind of an epiphany, like I want to get into health and wellness. So I went and got my degree in health promotion from App State, which I saw that moving in the direction of preventing chronic disease through diet and exercise. And so I went and applied at an organization in my hometown of Hickory, and I started doing community outreach work with that organization, and just fell in love with everything about being in HIV prevention, the communities I get to serve, the work I get to do, and the fact that, like I told you, they pay me to talk about sex all day. Like, how do you get that kind of a job? And they pay you for it. Like, I would do it for free, but, I need my money. But it's wonderful work, and I go home at night knowing that I've impacted somebody's life in some way. And I've had clients who have stuck with me because of their story, their situation, and I always approach my work from a place of empathy and compassion, because we're not so far removed from the people that we may look down on, whether it's injection drug users. Like, if we just treat people like people with respect, regardless of their race, their gender, their sexual orientation, like any of those things, and just focus on compassion and empathy for another living being, I think we can make the world a better place.
I know you have a lot of different sessions talking that you go around the city. Tell us about some of the ones that you have coming up, or where they can get more.
Well, those are really kind of private, so I do go to like substance use clinics, and I specifically educate people who are in those groups. I go to some of the universities in the area, but if a person is really interested in getting tested, they can always call me at my office, and that number is 704-496-9579 to make an appointment for testing. And just to kind of talk a little bit about testing, there are 2 types of tests that we perform in the office. One is a rapid HIV test, which takes about 10 minutes. People can come in, get tested, get their results, and go on about their business. I'll give them some condoms. Otherwise, we can do a blood draw and test for HIV, hepatitis C, and syphilis. These are available to our community members at no charge. You don't have to bring an ID. You don't have to bring insurance or anything. Just call me and make an appointment. And what that testing would tell me is that if a person contracted HIV or syphilis or hepatitis C from the moment they were born up until about 3 months ago. So there's a 3-month window period in testing that I can't see anything. So if a person had unprotected sex like 2 weeks ago, they've got to wait 90 days from those 2 weeks to get tested. And also operated outside of our office is syringe exchange, because we know that injection drug use is a really high risk for people contracting HIV due to the sharing of needles. And so we collaborate with Queen City Needle Exchange with Centers for Prevention Services. So we offer clean needles, sterile water, everything a person needs to inject drugs. And I know people feel certain ways about that, but I'm in public health and I come from a perspective of harm reduction. We know that people are going to inject drugs. Let's make sure that they do that cleanly. And it's really no different from a condom. We know people are going to have sex. Let's try to help them be protected. And like I said, I feel like when we take the moral judgments out of it and we just think about treating people, then it gets a little bit easier. But North Carolina is a harm reduction state, which just means that people don't get prosecuted if you're in the presence of a person who's overdosing. You're not going to go to jail if you call and ask for help to get that person, where they need to be. That also means that if you're a part of a syringe exchange program, you can carry some syringes with a little bit of residue and not be prosecuted for that. And that's essential in this fight against not only HIV, but hepatitis C as well.
I know y'all mentioned that Mecklenburg County was high as far as in North Carolina and in the country with HIV. Who is the leading county in the state of North Carolina with HIV?
I don't have that data with me, but I would imagine it's probably Mecklenburg County or either Fayetteville. Like Fayetteville, the military town, like the HIV rates are high there.
What's the other one? Edgecombe? They're right behind us.
Wilmington, I think it's pretty high up at the beach too.
Oh, okay.
So, that the data just shows us that it's primarily young, black, gay men who are getting HIV. Like that's the top demographic of people who are getting HIV. And so if you fall into that category, PrEP is ideal. Get on PrEP. In Mecklenburg County, there are programs that help people pay for the medication, or either they come out of no out-of-pocket expenses. So have that conversation with your doctor about getting on PrEP if you're a young black man who has sex with other men.
Now, in closing, what would one thing each one of y'all would say to our viewing audience about HIV that they would really stand out and,
I would want people to know that number one, you got to get tested, and number two, that HIV is not a death sentence, so you don't have to fear it. We want to take the fear out of a diagnosis such as HIV and know that medication has really advanced and people live long, healthy lives, and it's manageable. And that's what I want people to know, that you got to get tested. Knowledge is power. And so I just encourage testing. That's my passion.
Mine would be everyone can catch HIV. Mm-hmm. Everyone can catch HIV, from the 12-year-old to the 89-year-old people in the nursing home. So no one's safe. If you're having sex, you're at risk of catching HIV.
Yes.
So I would like to thank each one of y'all for coming on the show. And I would like y'all to come back and talk some more about this topic, because this is a big topic.
We just scratched the surface.
Yes, ma'am. That's what I'm saying. But thank you for watching this show, and you be encouraged.